Which guidance should the nurse offer to a female patient diagnosed with primary herpes genitalis? A. Administer 1 dose of turconazole intravaginally before bedtime for a duration of 5 days. B. Apply a cyclovir ointment to the lesions every 4 hours 6 times a day for 10 days. C. Use sulconazole nitrate twice daily, gently rubbing it into the lesions. D. Insert 1 applicator of ticonazole intravaginally at bedtime for a week. Correct option: B. Apply a cyclovir ointment to the lesions every 4 hours 6 times a day for 10 days. The suitable recommendation for a client diagnosed with primary herpes genitalis is to apply a cyclovir ointment to the lesions every 4 hours, 6 times a day, for 10 days. Turconazole and tioconazole are typically utilized for vulvovaginal candidiasis, while sulconazole nitrate is indicated for tinea vesicolor. What is the primary instruction the nurse should emphasize to a client following a recent skin graft? A. Apply lubricating lotion to the graft site. B. Continue physical therapy.
Nclex coaching.
C. Protect the graft from direct sunlight. D. Utilize cosmetic camouflage techniques. Option C is correct. Protect the graft from direct sunlight. The utmost priority for the client who has undergone a skin graft is to protect the graft from direct sunlight to prevent burning and sloughing. While physical therapy, cosmetic camouflage techniques, and applying lubricating lotion are beneficial, they are of lesser importance in this context. During a visit to the physician's office, a male client seeks treatment for severe sunburn. The nurse seizes the opportunity to discuss the significance of shielding the skin from the sun's harmful radiation. Which advice would most effectively prevent skin damage? A. Apply sunscreen with a sun protection factor SPF of 7 or higher. B. Seek shade while at the beach to prevent sunburn. C. Reduce sun exposure during the hours of 2 to 5 p.m. when the sun's rays are strongest. D. Use sunscreen even when the sky is cloudy. Correct answer is option D. Use sunscreen even when the sky is cloudy. To prevent skin damage, it's crucial to use sunscreen even when the sky is cloudy, as the sun's rays can still cause harm. Applying sunscreen with an SPF of at least 15 is recommended. Seeking shade at the beach may not provide sufficient protection, as reflective surfaces like sand, concrete, and water can still expose the skin to significant sunlight. It's more effective to minimize sun exposure between 10 a.m. and 2 p.m. rather than from 2 to 5 p.m. when the sun's rays are strongest. For the treatment of a skin disorder, what is the primary prescription expected by the nurse when a male client visits the physician's office? A. An oral antibiotic. B. An IV corticosteroid. C. A topical agent. D. An IV antibiotic. Correct option: C. A topical agent. In managing skin disorders, the primary treatment approach typically involves prescribing topical agents rather than oral or intravenous medications. A male patient visits a dermatologist regarding a skin issue. After reviewing the patient's chart, the nurse notes that the primary complaint listed is intertrigo. What does intertrigo refer to? A. Inflammation caused by a fungus penetrating the skin's surface and causing infection. B. Follicular inflammation. C. Irritation of adjacent skin surfaces due to friction. D. Spontaneous formation of wheals. Correct answer: C. Irritation of adjacent skin surfaces due to friction. Explanation: Intertrigo describes the irritation and inflammation that arises between skin folds or neighboring skin surfaces due to friction. It's important to differentiate intertrigo from other skin conditions, such as dermatophyte infections, option A, folliculitis, option B, and urticaria, option D. What risk does genital herpes simplex pose for a 45-year-old female client receiving outpatient treatment, as the nurse emphasizes preventive measures to reduce recurrences and prompt treatment for complications? A. Cancer of the ovaries. B. Cancer of the cervix. C. Cancer of the vagina. D. Cancer of the uterus. Correct option is B. Cancer of the cervix. Genital herpes simplex increases the risk of cervical cancer in women. However, it does not elevate the risk of ovarian, uterine, or vaginal cancer. Before we move on to the next question, we have urgent news for you. We've meticulously crafted a 100-hour animated NCLEX review crash course, and for this month only. In the initial 30 hours, we comprehensively cover all the crucial NCLEX topics with engaging animations, but that is just the beginning. The remaining 70 hours are dedicated to dissecting 5,000 NCLEX questions through dynamic animations. Along with animated lectures, you will also get NGN questions, an ebook, practice test series, and many more resources. Imagine learning with interactive visuals instead of being buried in a mound of tedious text. Say farewell to monotonous study sessions and welcome a revolutionary animated learning experience. This 100-hour course is your passport to mastering the NCLEX exam with unwavering confidence. Remember, animation significantly enhances information retention. Don't miss out on this limited time offer. We're offering an astounding 70% off for this month only. Click the link below, enroll today, and embark on a journey where animated education leads to exam triumph. Your success story begins now with our 100-hour animated NCLEX course at an incredible 70% off. Enroll immediately and wave goodbye to dreary textbooks. Now, let's swiftly move on to the next question. After undergoing treatment for a full-thickness, third-degree burn on his right leg with artificial skin, a male client comprehends post-operative care instructions. Which restriction does the client understand he should adhere to during the initial 7 days following the procedure? A. Reducing range of motion. B. Limiting fluid ingestion. C. Restraining outdoor activities. D. Decreasing protein intake. Correct answer is A. Reducing range of motion. During the initial 7 days after the application of artificial skin to treat a full-thickness burn, the client should restrict range of motion to prevent disruption of the artificial skin's adherence to the wound bed. Protein intake and fluid ingestion are crucial for healing and should not be limited. It is acceptable for the client to engage in outdoor activities as long as the affected area is adequately protected from direct sunlight. A male client is brought to the emergency department with second and third degree burns on the left arm, left anterior leg, and anterior trunk. Using the rule of nines, what is the total body surface area that has been burned? A. 30%. B. 25%. C. 20%. D. 36%. Correct answer? D. 36%. To calculate the total body surface area burned using the rule of nines, the arms account for 9% each, the anterior legs account for 9% each, and the anterior trunk accounts for 18%. Thus, the client's burns cover 36% of the body surface area. What should be the nurse's primary concern for a female client with a solar burn affecting the chest, back, face, and arms seen in urgent care? A. Fluid resuscitation. B. Infection. C. Pain management. D. Body image. The correct answer is C. Pain management. The main priority for a client with a superficial partial thickness burn, like a sunburn, is pain management. Concerns about infection and fluid resuscitation become relevant if the burn extends deeper into the skin layers. While body image disturbance is important, it's of lower priority compared to addressing pain. What adverse reaction should the nurse assess for in a female client with a severe staphylococcal infection receiving the aminoglycoside gentamicin sulfate, garamicin, via the IV route? A. Auditory nerve damage. B. Cardiac dysrhythmias. C. Convulsive episodes. D. Bone marrow suppression. Correct answer: A. Auditory nerve damage. The nurse should particularly monitor for auditory nerve damage in a female client with a severe staphylococcal infection receiving gentamicin sulfate intravenously. Auditory nerve damage presents with symptoms such as vertigo, tinnitus, and hearing loss, commonly observed with aminoglycosides. Other adverse effects, such as cardiac dysrhythmias, convulsive episodes, and bone marrow suppression, are not typically associated with gentamicin. Which nursing intervention is beneficial for assisting a client in maintaining skin health? A. Refraining from using strong detergents during the client's bathing routine. B. Suggest opting for loose-fitting attire during hot weather. C. Ensure the client remains adequately hydrated. D. Swiftly removing adhesive tape from the skin. Correct answer is C. Ensure the client remains adequately hydrated. Maintaining the client's hydration levels is crucial in preventing skin issues such as cracking and infection, as healthy skin serves as the body's primary defense mechanism. To promote healthy skin, nurses should opt for mild detergents instead of harsh ones during bathing. Swift removal of adhesive tape should be avoided as it may cause skin damage. Loose-fitting clothing is recommended in hot weather to facilitate heat dissipation through evaporation. During his stay at a skilled nursing facility, a male patient developed scabies, which was diagnosed the day following his discharge. Now residing in his daughter's home alongside 5 other individuals, he seeks guidance during a clinic visit, expressing concerns about the potential risk to his family. Asking a staff nurse, he inquires, "What precautions should my family take?" The nurse's most accurate response would be A. Following your treatment, family members won't be at risk of contracting scabies. B. All household members should undergo treatment. C. If any family member exhibits symptoms, they should promptly seek medical attention. D. It's essential to refrain from sharing linens and towels among family members. The correct option is B. All household members should undergo treatment. Explanation: scabies contracted within shared living environments requires prompt treatment for all household members to prevent further infestation spread. Additionally, preventive measures like avoiding the sharing of linens and towels are crucial in reducing transmission risk. Given the contagious nature of scabies, even before symptoms appear, proactive measures are essential to effectively contain its spread. A nurse identifies scabies during the assessment of a client recently moved to the medical surgical unit from the day surgery unit. To prevent scabies transmission to other patients, the nurse should A. Inform the nurse in the day surgery unit about a possible scabies outbreak. B. Implement enteric precautions for the client. C. Quarantine the client's bedding until they are no longer contagious. D. Clean hands thoroughly, apply a pediculicide to the client's scalp, and remove visible mites. Correct answer: C. Quarantine the client's bedding until they are no longer contagious. To curb scabies spread among hospitalized patients, it's crucial to isolate the client's bedding until they are no longer contagious, typically after 24 hours of treatment. Additionally, maintaining strict hand hygiene and using gloves during treatment application and all client interactions are essential precautions. While informing the day surgery unit nurse about the situation is necessary, A widespread scabies epidemic is improbable, as scabies mainly spreads through skin-to-skin or sexual contact. Enteric precautions are unnecessary since scabies mites aren't present in feces. In a session focusing on first aid principles, the nurse discusses the necessary steps to manage a snake bite on an extremity. Participants learn about the foremost action required in such a situation. What is the primary intervention? A. Lower the extremity below the heart level. B. Relocate the victim to safety from the snake and recommend rest. C. Stabilize the affected extremity. D. Remove any adornments and tight attire from the individual. Correct answer is B. Relocate the victim to safety from the snake and recommend rest. In the case of a snake bite, the immediate priority is to move the victim to a secure location away from the snake and promote rest, with the aim of minimizing venom circulation. Subsequently, any jewelry and constricting clothing should be removed before swelling occurs. Stabilizing the extremity and ensuring it remains at heart level are subsequent steps, aiding in limiting venom dissemination. Additionally, maintaining the victim's warmth and calmness is essential. It is recommended to avoid substances such as alcohol or caffeinated beverages, as they might hasten venom absorption. Lastly, prompt transportation to an emergency facility is vital. When a patient presents at the emergency department after direct exposure to poison ivy shrubs without visible skin signs, appropriate advice is crucial. The nurse should consider which of the following responses. A. Seek immediate medical attention. B. Apply calamine lotion promptly. C. Take an immediate shower, ensuring thorough lathering and rinsing. D. No action is necessary if there are no visible symptoms. Correct answer is C. Take a shower, ensuring thorough lathering and rinsing multiple times. Contact with poison ivy often leaves an invisible sap film on the skin, which can cause irritation or allergic reactions. Therefore, it is imperative to cleanse the affected area thoroughly. Advising the patient to take an immediate shower and ensuring thorough lathering and rinsing under running water helps eliminate any remaining sap, significantly reducing the risk of irritation. While calamine lotion may offer relief if dermatitis occurs, it does not address the immediate need to remove the sap from the skin. In a hospital admission for acute cellulitis in the right arm, what clinical signs would the nurse likely observe? A. Superficial infection involving the dermis and lymphatic vessels. B. Infection of the outer skin layer and lymphatic vessels due to Staphylococcus aureus. C. Infection affecting the dermis and the layer beneath it. D. Inflammation restricted to the outer layer of skin. Correct answer is C. Infection affecting the dermis and the layer beneath it. Cellulitis typically involves infection of both the dermis and the underlying hypodermis, presenting as deep red erythema with poorly defined borders and spreading extensively through tissue spaces. Affected skin typically displays redness, swelling, tenderness, and occasionally nodularity. It's crucial to distinguish cellulitis from erysipelas, which is characterized by acute, superficial, rapidly spreading inflammation of the dermis and lymphatics. Cellulitis extends beyond the epidermis, involving deeper layers of the skin. In the realm of medical diagnostics, what test serves as the gold standard for confirming a diagnosis of herpes zoster, shingles? A. Positive finding on culture examination. B. Identification of abnormal biopsy results. C. Positive response on patch test. D. Detection of infection under Wood's light. Correct answer. Option A. Positive findings on culture examination. Here's the explanation. The definitive diagnosis of herpes zoster relies on the presence of the varicella zoster virus obtained through culture examination of the lesion. Herpes zoster arises from the reactivation of the varicella zoster virus, the causative agent of chickenpox. Biopsies entail microscopic scrutiny of tissue samples, which may help identify abnormalities, but are not the golden standard for diagnosis. Patch tests are geared toward identifying specific allergies by administering allergens to the skin and are not relevant to herpes zoster diagnosis. Woods light examination employs ultraviolet light to uncover superficial skin infections, but is not specific to herpes zoster. Upon arrival at the emergency department, a patient presents with frostbite affecting the left hand. What observation would the nurse likely make during the assessment of the affected hand? A. The skin of the hand appears white, accompanied by an absence of sensation to touch. B. The fingertips exhibit blackened areas surrounded by a rash that appears red. C. The hand appears pink and swollen. D. The skin of the hand displays a fiery red hue with swelling evident in the nail beds. The correct option is A. The skin of the hand appears white, accompanied by an absence of sensation to touch. Frostbite assessment typically reveals a pallid or bluish tint of the skin, which feels rigid, cold, and lacks tactile sensation. As thawing progresses, skin flushing, blistering, or tissue edema may occur. Option A corresponds to the typical manifestation of frostbite, aligning with the expected observation during assessment. Options B, C, and D do not align with the typical manifestation of frostbite. Upon examining the nursing records in the client's chart, the morning nurse observes that the night nurse documented the existence of a stage 2 pressure ulcer on the sacral area. Consequently, when evaluating the client's sacral region, the nurse would expect to find which of the following? A. Exposed bone, tendon, or muscle. B. Skin without any damage. C. Partial loss of skin thickness involving the dermis. D. Complete loss of skin thickness. Correct answer is C. Partial loss of skin thickness involving the dermis. A stage 2 pressure ulcer indicates that the skin is not fully intact. It involves partial thickness loss of the dermis, appearing as a shallow open sore with a red-pink wound bed, typically lacking slough. Furthermore, it may appear as an intact blister filled with serum, or as an open, ruptured one. Stage 1 pressure ulcers exhibit intact skin, whereas Stage 3 involves full thickness skin loss. Stage 4 pressure ulcers entail the exposure of bone, tendon, or muscle. In preparation to care for a burnt patient undergoing an escharotomy for a 3rd-degree circumferential leg burn, what result does the nurse expect from this procedure? A. Vigorous bleeding from the incision site. B. Restoration of distal pulses. C. Development of granulation tissue. D. Reduction in edema formation. The correct answer is B. Restoration of distal pulses. Escharotomies are essential interventions to relieve compartment syndrome caused by edema beneath the non-distensible eschar in 3rd-degree circumferential burns. By releasing the constriction around the affected area, particularly the arm in this instance, the procedure aims to restore distal pulses. While bleeding from the incision site might occur as an adverse event, it's not the intended therapeutic outcome. Typically, bleeding can be managed with direct pressure and elevation, although arterial damage may require ligation. Edema formation isn't directly impacted by an escharotomy, and the formation of granulation tissue isn't its intended goal.